Hello, and welcome to the FAQ and Gear Up How It Works for You webinar. My name is Cami Hallett, and we've had a number of doctors across the United States who have requested this short little webinar, just kind of giving you as a practitioner a visual of how the FAQ software and the Gear Up coaching work and how they work together. So many of you have been to a seminar and gotten to have the privilege to hear Dr. Patrick Flynn speak, and throughout his seminar learning about functional medicine, you no doubt noticed that he made references to the FAQ software and how that can be a major help to a practitioner who is wanting to start doing functional medicine in their practice. And it's really a turnkey system for you to get that started. So this is a webinar that we kind of had requested that's just kind of a quick visual step-by-step walkthrough of what it looks like when you are using the FAQ software in your office. So let's get started right away. First of all, from a patient's point of view, this is what the FAQ software will look like. Now, keep in mind, this is ideally the patient's first introduction to you. So it really creates a very professional introduction to the patient for you. Cutting edge technology. Patients are really into the latest and greatest. And when a patient's first experience with you and your office is an online health analysis, a functional health analysis, that really creates a lot of credibility and a lot of professionalism for you in your practice. So this is what it looks like from the patient's point of view when they do the FAQ software. They fill out the assessment questionnaire. This is the page that they will see when they go online, and as you can see here, it says practitioner's account number, and you will have your own practitioner's account number for the software. Now, our clients typically will either utilize this page, because every doctor will get their own practitioner's account number. It's a very nice, very nice looking front page there for the functional assessment questionnaire. But you can also choose to embed the URL directly into your website. So you can have them go directly to your website to fill it out, and they would then be seeing your website page and then would be directly routed to the next screen, which I will take you to right now. And so you could have that come straight from your website, or you can use this this first page here as well, either way. But you'll have your practitioner's account number, and then it will bring the patient to this page where they will fill out all of their information. And as you can see here, the first thing it asks them for is their top 5 major health concerns in order of importance to them. So that's really a good reference to you to know what symptoms they're looking for right off the bat to get corrected, and can give you a lot of insight and information there. So they fill that page out first and click continue, and then it takes them directly to the functional assessment questionnaire. Now, this is an example of what the sections will look like, and the patient will have the option to do 1, 2, or 3, or 0. And as you can see at the top, it has the key at the top of every page for them. It has the key for what those numbers mean. And so they will simply go through and read each of the symptoms and click the severity level, or if they have it at all even, and then they'll click continue, and they'll continue on through each of the sections. There are 15 different sections and over 400 different questions for the patient, so it's very thorough analysis. And this is an example of what it would look like when they've clicked on it, and when they've answered the questions, what they look like. And of course, like I said, there's 15 different sections. So once they finish filling out the functional assessment questionnaire, they will click on the green button to the right there and click Submit Assessment. And this is the screen that they will then see, congratulating them for filling that out. And it says, of course, for them to contact you, because the patient will not they will not have access to their own results. The results are going to come directly to you as a practitioner. And the minute that they click that previous button on that page, that green print assessment, you will have an email alerting you that one of your patients has filled out the functional assessment questionnaire and that the results are now available to you. And you can click right in that email, you can click on a link and it'll direct you right to their results. If you have have an iPhone or a smartphone, you can do it directly from your smartphone if you're out on the go and you see that someone filled out the FAQ. And you can look at those results there, and then also you can go directly into the FAQ software and do a patient search and bring up a patient's results right there. So that basically kind of ends what the patient's point of view is on the FAQ software. And now we're going to take a look at it from your perspective, from the practitioner's viewpoint, because this will be the back side of the software that you have access to. So, Functional Assessment Questionnaire, you will go to this page, functionalfaq.com/doctors, and you will have your own username and password for your software. And then you can just click on Log In, and that will take you directly to this page where you can search right away. It brings it up right away where you can search for a patient via their last name. There's a couple different options there. And then you just click on Search. There's a button for adding a patient, and then underneath that green button that says add a patient, you can also click where it says select list of all patients. So say you have a little bit of difficulty remembering a patient with a large last name or how to spell it, you can just click that and search through alphabetically all the patients that you have in there. That's also a good reference for you to see how many patients have filled out the FAQ and all that type of stuff, so you can get a lot of information when you click on that select list of all patients. And then, moving on, this is a screen, and these are just examples. Basically, what I want to do with this webinar is give you some pictures of what it will look like, step by step, how the process works. So you had a patient present, and you refer them to do the online health analysis, this functional assessment questionnaire. They have done it, and now you are getting the results. So this is just an example of what a patient's results would look like. Here we have Sarah Anderson, and these are her top 5 concerns. And if you click on the right-hand side there, you see the 4 buttons. There's the preliminary report, and that is the one that you will click on to see the results of their FAQ. Now, there's also view assessment. That would be a button you would click on if you wanted to see their answer to every single question. Like you saw earlier what the sections looked like. If you wanted to actually view that, how they filled it out, you could click view assessment, and that would show you all 15 sections, each question, and what severity they chose for an answer for that symptom. But typically what our doctors use is a preliminary report, because that's where it takes all the information and puts it in a really nice one-page report. And we'll see that here in a few minutes. And then, of course, the green button, you can click to print the assessment if you'd like to do that as well. Okay, so preliminary clinician report. This is what you clicked on, and this gives you all of her data, if you will, in a nice report for you. It's all categorized, it's all prioritized for areas of dysfunction, putting the most important or the most severe dysfunction at the top to the least, so that you can see all that. You can see at the top there's a graph with that blue bar, and that gives you the best possible score that this patient could have gotten is a 0, and the worst possible score is 825. And so you can see at a glance what her score was. She totaled in at a 218. So that can kind of give you a gauge of how much dysfunction, how severe is going on in her system. And then you have each of these sections prioritized for you of where is the best place to start with functional medicine, with functional testing, because that's one of the major challenges to practitioners that are interested in moving more toward functional medicine and utilizing the functional testing that is so key, is where do they start? Many times you have patients that will present with a number of symptoms, a number of health conditions. They're on a number of different drugs, and trying to get to the root cause of what's going on, which is at the core of functional medicine, is very, very difficult. And so this just really makes it turnkey for you, because it lays out for you very clearly, okay, these are the areas that are most severe, that are topping out. As for Sarah, this shows her thyroid is a great place to start, her adrenal glands, heavy metals there is an issue. So those are the 3 that topped out for her as most severe. And that's a great place to start with testing, because then you know, based off these results, you are going to test in these areas, you're going to find something. You're going to find what you're looking for and what you need in order to where to start your treatment to get the best results with her and get symptom relief for her. So it's very cool that way. Now, so the next challenge for a practitioner wanting to do functional medicine is we targeted the area where we should start with testing and also with treatment plan. But the next challenge is, what tests do we recommend for this patient? Because there are many, many labs out there and way more tests as well. There's hundreds and hundreds of lab tests out there that a practitioner could utilize. And so that can be the tricky thing, is now that we kind of have pinpointed and targeted where we need to do some testing, what is the best test that this patient should do to give you the most information in order for you to come up with a treatment plan for this patient? And so we're going to click on thyroid, and that is going to give us, this page is going to pop up in your functional assessment software, and it's going to tell you the best test to utilize for this patient. And as you can see at the top there, it recommends thyroid profile 3. And so then it takes all the guesswork out of the testing. Now there's several options on this page. You would only ever pick one test on this page. And the reason is for that is we have several different types of practitioners. Some of them choose to do blood draws, some of them not. Some of them choose to work with only 1 or 2 labs. So that's why there's several options, so that this software works for any practitioner, however they choose to do the testing and utilize it. But basically it will give you the test. These are the test options, and you can choose which one from this list, and typically for the most part you would choose the top test that shows up on the screen. Now if you'll notice to your right, there are a bunch of blue dots and to the right of each test, and if you click on that, it will give you a report for the patient on that test. So we'll do that. Okay, so then it will give you a test explanation page, and basically what this does is it explains to the patient why you are recommending this test. So not only do you have that preliminary report to lay in front of them to create some value in there and look at that and go, oh my goodness, what's going on with my thyroid? What's going on with my adrenal glands? Or that really fits in with what I've been struggling with. So you have that report, which is awesome for creating value with the patient, but then you also have this test explanation page to create some value with the patient for doing that test. And basically it says, based on your FAQ results, they showed this is what's going on. And then a lot of times the patients will really, it really resonates with them, those top things that are listed there. These are some of the things that thyroid dysfunction can be caused by. And many times they'll point and go, yeah, I've got this in my life, I've got extra stress or toxicity, I don't eat very well, whatever it is. And so it lists those things. But then the cool thing is the next step below that, it says if this dysfunction is not addressed, and this is basically a picture of what their future looks like. And these are the things that it's going to lead to, or that are going to continue to get worse. Weight issues, hair loss, skin conditions, and they may be experiencing some of these already. And so you can kind of say, listen, if you don't get this corrected, if we don't get this test to see what's really going on, this is what your future looks like. These symptoms, if you don't have them, they're coming. If you already have them, they're going to get worse. We need to do something about this. So it really creates a good value for the patient there. And then it says the following test is being recommended, and it lists the name of the test right there. So it really helps you with those first challenges of, where do I start for functional medicine, treatment? Where do I start for the testing? And then where do I start with treatment? So it really takes a lot of the guesswork out of it. On to the next page, then this is just an example then of the patient's test results. The test was ordered, the thyroid panel 3, and here's the test results that then came back. So step by step, all of these things have been very simple for you. So now the patient decided to do the testing, you ordered the test results are back. So now the next challenge is, you pinpointed and targeted the area to start at, you did the testing. Well, now how do you interpret the test results? What do they mean, and how do you come up with a treatment plan based off of this patient's test results? And so that's where the gear up side of it comes in. You've got the software to get you to this point.